beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is to bring you Heart Failure Awareness Week's information. In this video, I'm going to discuss heart failure. I'm going to talk about major risk factors and some symptoms that you can pay attention to keep yourself healthy and or keep yourself in the know in terms of early diagnosis. So, heart failure, it basically means or it happens as a result of the heart losing its ability to pump well because of injury to the muscle, whether it be from something like a heart attack or whether it be from a long-standing history of uncontrolled high blood pressure. So in heart failure, you can have, as I said, multiple risk factors, including high blood pressure, including coronary artery disease, heart attack, heart valve disease, diabetes, obesity, and there's a bunch of them. So let me not forget heart muscle disease or cardiomyopathy, congenital heart disease, obviously family history of cardiomyopathy, and something that people do not think about, but sleep apnea. Whether it be obstructive sleep apnea or whatever etiology of sleep apnea, that's when you stop breathing while you're sleeping. Or also severe lung disease. Both sleep apnea and severe lung disease can cause something called cor pulmonale. And again, those are risk factors for heart failure, meaning that those are contributing to the heart's inability to pump like it's supposed to. And when I say the heart loses its inability to pump, I mean the heart is either losing its ability to squeeze or actually pump blood to the rest of the body, or it's losing its inability to fill and relax in order to fill up with the adequate amount of blood to pump to the rest of the body. Because you got to think about this. The heart's main function is to pump blood to the rest of the body, blood that has been well oxygenated so that the rest of your body's organs, such as your heart, your brain, your kidneys, all of the tissues in your body that are vital to functioning, your heart is trying to pump that newly oxygenated, fresh, vibrant blood to the rest of your body's organs so you can function. Which leads me to the symptoms of heart disease or heart failure. And there's a lot of them, so I want to read this. I don't want to miss anything, and I'm going to break them down in terms of categories. So with heart failure, you can have breathing difficulties, which that's from congestion, and it has to do with the left side of the heart, okay, backing up. So breathing problems, you can get shortness of breath while you're walking or doing activities. We call that dyspnea. You can have trouble breathing when resting or when laying flat. You can have waking up at night feeling out of breath, needing more than 2 pillows to sleep because you can no longer lay flat and you have to sit up more upright in order to oxygenate well, getting tired easily, frequently coughing, not related to COVID, obviously, but frequent coughing, cough that produces a pink, frothy type of mucus, or dry hacking when you're laying flat in bed. Those are all of the breathing problem related symptoms related to heart failure. Now we're going to go into congestion of the right side of the heart. And this you can see kind of like in other parts of your body. And that includes swelling of the feet, ankles, legs. That's called edema. You can have an increased need to pee or urinate because your body is trying to urinate off all of that extra fluid that's getting backed up from the right side of the heart. Swelling of the abdomen. edema. And I don't mean a fat belly or you ate a lot of food and now you're bloated. I mean physical edema, to where if you press on a little part of your belly, you make a dent in there. That means you have ascites. Or sometimes you don't have a dent in there, because that would be more so anasarca. But ascites, meaning your belly is full of fluid, not your stomach or your intestines or your colon. Your abdomen just has extra fluid in there because you're retaining fluid. And then also lack of appetite and nausea has to do with congestion of the right side of the heart. Then there are some symptoms from low cardiac output. That means, like what I was talking about before, the heart's inability to pump or the inability to relax adequately. That causes low cardiac output, meaning a low amount of blood that's getting pumped out during each pump. Each beat of the heart, like they teach you, lub dub, lub dub, lub dub, whatever. The output is less because you're not squeezing, you're not pumping as well, so you're not pumping out as much blood, or you're not filling all the way, so you're not filling up enough blood to pump out. That is called low cardiac output, and these are the symptoms that are caused by that. Fatigue, cold legs and arms, and difficulty concentrating. Again, think about not getting enough blood and oxygen to your brain. That's going to cause some difficulty concentrating. It's going to cause you to feel tired. It's going to cause you to feel weak. Cold arms and legs, that's because physically the warm blood that is now getting pumped from your heart to the rest of the body, it's not really getting there adequately because there's not enough of it being pumped around at the time. So that's what could cause cold arms and legs. And like I said, difficulty concentrating. If you're not getting enough oxygenated blood to your brain, you're not going to be able to concentrate the way that you would with a lot or adequate amounts of oxygenated blood getting to your brain. So those are some symptoms. Obviously, some are more obvious than others, like swelling in the legs. You can physically see that. Difficulty breathing, you can physically feel that when getting out of breath when you're doing activities, or not being able to lay flat anymore because you can't breathe. Those are obvious. The ones like feeling tired and things like that, those are a little more vague because they can be related to a lot of different things. But these are just some symptoms that I'm putting out there for you that should raise a red flag in terms of getting to a doctor to get testing for this. For heart failure specifically, you would want to get an echo or an ultrasound of your heart where they can measure the ejection fraction, which that has to do with cardiac output and how much blood is actually being pumped to the rest of your body and how well your heart is doing at that. An echo would be able to see the function of the heart and therefore tell if you have heart failure and what type of heart failure you have. With these symptoms, however, you could have heart failure just with a list of these symptoms. It'll be like, yeah, you're more likely to have it, you should get checked, or you don't have these symptoms. Obviously, you can have mild heart failure prior to developing symptoms because your body's compensating. So I always recommend getting your annual checkup, seeing your doctors. If you have a family history of heart failure or any disease for that matter, but we're talking about heart failure right now, you should be very aware of these things and keep on top of it and, make changes. Diet and exercise are always a no-brainer. That's the first thing you can do to take charge of your health. Have a good diet, and I don't mean by, you're not eating any calories, you're not eating carbs, you're not eating this or that. I just mean maintaining a healthy, balanced diet, putting good food into your body, and exercise obviously is always good for the body. But yes, keep these things in mind, especially if you have family history of heart failure. But be very aware, if you have any of these symptoms that I've listed in this video, please do seek professional care. So I hope that you learned something from this video. If you did, please like this video, subscribe to my YouTube channel, and share this with a friend or family member, because knowledge is power. I know that's cliche, but I'm just saying I do these videos for you guys because I do want to put information out there to have you take charge of your health and be in better health and live a full, healthy, and well life. So thank you for spending this wonderful Wednesday with me. Oh, if you have any comments or if you have any suggestions for future Wonderful Wednesdays, put that in the comment section below. But yes, thank you for spending this wonderful Wednesday with me. Be blessed and stay healthy.